Hey everyone. In today's episode, I'm thrilled to sit down with Mandi Dickey, an expert in brain health and neuroinflammation. She's a board-certified nurse practitioner with over 20 years in healthcare, primarily in neurology, and someone with a deeply personal healing story that I think many of you will relate to. So we're going to have a conversation today and talk about why your digestion and cognition are more connected than most people realize, how inflammation impacts both, and what that means when you feel stuck, foggy, or just like nothing is working. So welcome, Mandi.
Thanks for having me. I'm excited.
So one of the things I like to explain to clients is the gut and the brain are constantly connected. They're always talking to each other. It's a two-way street of communication. The gut has its own nervous system, the enteric nervous system, which produces 90% of the body's serotonin and more than 50% of the body's dopamine. So when somebody is dealing with anxiety, which is, I would say, the vast majority of my digestive health clients, mood issues, brain fog, or difficulty concentrating, we have to look at what's going on in the gut, right? And the same goes in reverse.
Absolutely.
Yeah, so with the reverse, chronic stress, trauma, or nervous system dysregulation can affect motility, enzyme output, and even how the microbiome is composed. So I've worked with many people who everything was fine until a major stressful event happened and suddenly they're bloated, constipated, they have food sensitivities. And the other thing that I've been talking about more recently, and I'd love to hear your thoughts on this, is that it's not just about when you're stressed, but when there's been chronic stress for a while, the nervous system can get stuck in that fight or flight or just learns how to go right to it and doesn't learn the resting pathways, basically. So this decreases the signaling and blood flow to the GI tract, which can affect how we digest our food, how quickly everything moves through. First, do you want to talk a little bit about your background and tell a little bit about your story?
Sure. Yeah. So I've worked in healthcare since 1999 to some aspect. I started as a nursing assistant and then I was a nurse for many years. And then in 2012, I became a nurse practitioner. And almost all of it was in neurology. The very few years I think were spent outside of neurology. So I found my calling with the brain related issues early on in my practice. And for a long time, I was working in the stroke world as a nurse practitioner in neurology. And there, we didn't really talk about nutrition quite as much, other than the fact that it is a risk factor when we're talking about risk for stroke, whether or not somebody is eating well. We don't often think of that. We usually think of like high blood pressure, diabetes, things like that. But your nutrition affects those things. What you eat on a regular basis will affect your blood pressure. It'll affect your blood sugar. So we did talk about diet as far as that was concerned. But in 2023, I was in a car accident and had a traumatic brain injury. And I learned firsthand that so much more can happen when your brain has a trauma than we even knew from what I learned in nursing school and nurse practitioner school. So there was nothing that I had ever seen before. The fact that a trauma can initiate your cortisol to be completely off and then your diet gets adjusted significantly. With a traumatic brain injury, you can have either an increase or a decrease in your appetite. And that is all related to a lot of the hormones that get affected from the pituitary in your brain. And you can't see the damage, but you can see it in people's symptoms. So it's not something that shows up on imaging. So I've learned so much from being on the patient side of things that school didn't teach me.
Amazing. Wow. And that was only 2 years ago. And you seem to be functioning well. To what extent did that affect you? What was the recovery like for you?
Yeah, so I'm still recovering. The funny part about brain injury is that it's an invisible injury and most people can't see it. For a good 6 months, I would lose track of my thought in the middle of a sentence. So I couldn't have conversations with people. I started my own podcast 6 months prior to my accident, but thank goodness I had 6 months of interviews already recorded and just ready to put out because I couldn't carry on a conversation. I couldn't remember what was going on, what we were talking about. Literally would lose track of my thoughts or lose the words, and I would substitute the wrong words for a long time. My balance was affected, my vision, my nutrition. I completely lost my appetite after my accident. So trying to make myself eat was a whole new ball game that I had never had happen before. Every time I was stressed before in life, I had an increase in appetite. This was something I'd never experienced. So now it's been 2 years. This past weekend was 2 years exactly from my accident. And I am just now getting back to work very part time as a nurse practitioner. Prior to that point, I couldn't work as a nurse practitioner because I couldn't remember the conversation that we had. It took a long time to get to the point where I could remember what we were talking about in my podcast interviews. And I would listen to them afterwards and try to find little clips to use. And I would be surprised at conversations that we had because I didn't even remember talking about the things that we did in the interview. So it's interesting how long those symptoms can go on.
That sounds just so frustrating and challenging to deal with.
Yeah, for somebody with beyond a master's degree, it was very, very humbling experience, but it's given me a lot more passion. So I'm actually starting up a concussion program now within the neurology clinic that I'm working at to do some things better in the field of concussion because I know more because I've been there.
Yeah, absolutely. And it's interesting what you said about the appetite, because one of the things I talk about with my clients is that we start digesting our food as soon as we see it and smell it, before it's even in our mouth, because those olfactory signals, like that cephalic phase of digestion, is when we start thinking about food and seeing food and smelling food, and we're already salivating. And when you salivate, your whole digestive system is starting to salivate and produce enzymes and acid and release bile. It makes sense that a brain injury could affect your appetite.
Yeah, I had no idea it could be quite that dramatic. And I've talked to lots of other people who've had concussions that they maybe have an increased appetite. So they're eating more. So it's a wide shift of what can happen after a brain injury. Yeah, it's interesting to see how it can completely shut off. And as you mentioned, the enteric nervous system part of it. For those who don't know, we've got in our nervous system, we've got the autonomic nervous system, which is your parasympathetic, your sympathetic, and the enteric. The sympathetic, we always think about when people are stressed and in fight and flight. Your parasympathetic kind of gets shut off, so it's not offsetting that sympathetic. But then the enteric part was the one I completely forgot about from school until I was experiencing it myself with all the nausea and digestive issues that I was having.
Yeah, yeah. So when you work with patients, do you at any point think about gut health, or do you ever start to suspect that someone's gut might be contributing to their symptoms, or vice versa?
Yeah, a few years ago, I really got exposed to functional medicine. And that's when I really started talking more about nutrition with my patients beyond the little bit that we were talking about. What you eat can affect your blood pressure and your diabetes and all that. But now, as I'm seeing patients in the concussion clinic, that's one of my questions all the time. How's your appetite? Have you had an increase or decrease? Have you had a change in your bowels? Have you had a change in just your general digestion? Are you now finding that you're intolerant of foods that you weren't before? Because trauma can affect that. And all of a sudden, now you are intolerant of things that you weren't intolerant of prior to your trauma.
Yeah, absolutely. The next thing I wanted to ask you was, do you think that brain health practitioners are talking enough about the microbiome and the gut brain axis? So the fact that you hadn't even really looked at that until you started learning more about functional nutrition answers that, right?
Yeah, most of my colleagues in neurology do not ask questions about that. It's not something that comes up. And to be honest, a lot of people I've talked with don't even think that it is that big of a thing. They think it's more related to anxiety, and people are having more issues because of that. So there's a lot of education yet to do in neurology and all of medicine, honestly, because unless you're working in a functional practice, you probably don't see it as a real thing.
Yeah, I was just going to say the same with the gastroenterology, standard gastroenterology. They're not talking about the microbiome. They're not talking about the gut brain axis. So, same thing. Standard medicine's not looking at that yet. They're starting to test for SIBO. The gastroenterology practices are starting to test for SIBO. So, that's a small step in that direction of looking at the microbiome. And I'm sure they will get there. I hope that they'll get there eventually.
I hope
But
so too. Yeah, my own personal experience when I had gone to a GI doctor, I knew that I had issues with gluten, but I wanted to get further testing. And I was talking about all the different things that I had sensitivities to. And at that time, I couldn't eat nightshade vegetables. And the GI doc says to me, "What are nightshade vegetables?" And I thought, oh my goodness, you should know this because this is huge in your field.
right. Yeah, absolutely. Yeah, that's a whole other conversation about our medical system and its shortcomings. But I'm curious, since this is your area, what nervous system microdilation tools do you find the most helpful? And you can talk about your population, the post-concussion population, to help with function and maybe even neurological inflammation.
Yeah, so this was a very new thing to me. This was literally in the last year that I've really found any of the tools. Heart rate variability is another thing as well. Absolutely. So microcurrent use. So not like a TENS unit. So a lot of people know of a TENS unit for different pain type of things. And it's a different kind of current that they use with this kind of technology to help calm down the autonomic nervous system so that you're not constantly in that fight or flight mode. And so that your gut can calm down and actually relax like it's supposed to. So microcurrent can be really useful for people that have chronic conditions that consist of anxiety, but it's not just an anxiety treatment in itself. A lot of it will be related to the anxiousness, the fight or flight part of the autonomic nervous system. Exercises that will calm it down, such as vagal nerve stimulation, vagus breathing. So, doing deep breathing techniques to try to calm the nervous system. And then ones that I've learned recently from a functional neurology provider that I've been seeing is pomegranate juice and its role in vasoconstriction and vasodilation so that you can actually calm down that nervous system as well. And complex movements to retrain your brain. So when you're feeling overstressed, when you're overstimulated, that again, you can calm down that autonomic nervous system. Overall, in the long term, all of those things are going to help to kind of calibrate that autonomic nervous system so it's not always on overdrive.
Yeah, I was going to ask, you said you called it current something.
Microcurrent.
I was going to ask you, is that the same as vagal nerve stimulation or it's different?
Slightly different. They can use it with a current that's used on the tongue, like a TENS unit type of thing, but the dolphin neurostimulation device is one version of them. And then they have other ones that are in clinic. I just talked to another local provider recently who uses this, and I'm actually going to go there and get a little bit more information about what they do in clinic. But they've used it a lot, even for dental issues when people have teeth grinding because of anxiety, and that's causing changes in their digestion because they aren't able to eat appropriately because now their teeth hurt and things like that. Going through and treating the teeth individually to get at the nervous system that way because so many of our nerves go through our mouth.
Wow, so that might even help with TMJ, I'm thinking too. Yeah, interesting.
So that was a brand new one to me. So I just learned that one.
Yeah, absolutely. I have the teeth grinding and the TMJ. So I'm always very interested in these things, and they're very relevant to the gut health world because of that vagus nerve, which we could talk about. Why don't we talk about that first? We're talking about this vagus nerve. I want to get into the vagus nerve stimulation a little bit more. How do you explain the role of the vagus nerve to your patients?
So the vagus nerve is the longest of our cranial nerves. We have 12 sets of cranial nerves that come out of the back part of our brain. The vagus nerve goes all the way from the base of your skull down into your bowels. It is the longest of the nerves that goes all the way down there. The rest of them are peripheral. They're meant to be peripheral, but this one has a direct connection with your brain and your gut. So if you have issues with your vagus nerve, some people will physically feel symptoms because it also innervates the diaphragm. So people get hiccups uncontrollably. That's that same overstimulation of that vagus nerve. So when your vagus nerve isn't working appropriately, in my terms of neurology, I've always talked to people about the gut-brain connection there because there is that direct connection. So if you're not eating appropriately, you're not feeding your nerve appropriately, and that information isn't going to get to the brain as it's supposed to. Same thing if your brain connection down to the gut is disrupted, if you have issues with your neck, if you have issues that are compressing those nerves, you might not realize it so much other than the fact that you now have digestive issues that you didn't have before. So it's really important to pay attention to all of those nerves because it does innervate all the way through your torso, essentially.
Yeah. So it connects the brain and the gut. And for me, my gut health issues started when I first started my private practice, which was the same time I was starting a new specialty. So I was starting the gut health specialty. Prior to that, I specialized in diabetes, weight loss, more general metabolic issues, and started gut health specialty and stepped away from my reliable, regular job to open my own business. So it was extremely stressful. I developed acid reflux, quickly realized completely stress was at the root of that, even though it did result in some food intolerances and things. So I had that going on, and that's so much better now because I started to identify the relationship with stress. And it didn't happen overnight, but I was able to learn how to manage my stress and calm my nervous. I didn't know I was really calming my nervous system. I didn't know much about the vagus nerve, but I was calming myself. And so all of that was much better in control. But I also have chronic constipation. So it's all related to that slow motility because I'm still, even though I'm not stressed like I was back then, I'm a go person, always like a huge to-do list, and I wake up and I just go. I don't relax. I don't like ease into my day. And the chronic constipation, it's not severe, but I've needed about 400 milligrams of magnesium citrate or oxide daily for a few years now to be regular. I started using the Truvaga vagal nerve stimulator, and I used it probably about 6 to 8 weeks. I don't use it anymore. And I no longer need any magnesium. Like, I just don't need it. It would make everything go the opposite way if I took it. So now I'm totally regular. I'm a big believer in all of this and super interested in it. And I wanted to try it first because it's not new. We've had vagal nerve stimulators for a while, but they've been invasive. You had to implant them. So now we have non-invasive versions, but I still wanted to try it out before I started recommending it. But now I definitely feel comfortable and I do recommend it to my clients.
Yeah. I started using the vagal nerve stimulator with the Dolphin NeuroStim device that I had gotten about a year or so ago with a practitioner I worked with very closely out of Canada because it's hard to find things like that here in the United States. But it was a device that I could use at home. She uses it in her practice and clinic, but it does send it home with some of her patients as well. So I was able to get it at home, and that connection, you're connecting with your ears and a pad on your belly while you're connecting it to the stimulator device itself. And you just sit and do your normal activities, and it's doing the exercises for your vagus nerve while you're sitting there. And it's super cool that you can just sit and do whatever while your vagus nerve is being retrained.
So that's different from the stimulator. How is it connecting to your vagus nerve?
Because of the patch on your abdomen, you're getting the vagus nerve that way, and it's drawing the information. When you have the clips on your ears, it's literally catching it from your cranial level all the way down to your abdomen with the device in between, and it's all interconnected between.
Wow. And what's that one called?
The dolphin. It's called the dolphin because different ways that you use it, it actually sounds like the squealing of a dolphin. So that's where they came up with the name of it. But it's a cool little handheld device. And so I use that for the vagus nerve stimulation as well as just the autonomic nervous system. There are different, almost like acupressure points that you can do throughout the body that will help to calm your autonomic nervous system as well. So there are 3 spots on your wrist, there's a spot on your breastbone, and then there's a spot at the crown of your head where you can do that, and it helps to calm down your autonomic nervous system at the level that you're doing it. So when I would have times when I was overstimulated, I could go sit down with my dolphin and listen to my little dolphin squeal and get my treatment in and calm down and breathe and go back to my activity.
How long do you do that? Do you use that dolphin?
It's 20 to 30 seconds per location. So a minute, 2 minutes, that's it.
Wow. Yeah. Okay. So, yeah, just so for the listeners, what I'm talking about with a vagus nerve stimulator, it's a handheld device as well, but it has a couple of metal plates, and you put it on your neck right where you would take your pulse, and it's connecting with the vagus nerve there, non-invasively, just through your skin. It's sending electrical signals. You can feel it like tickling, almost like it's strumming a guitar string. And you do it for 2 minutes at a time, or actually the research did 2 minutes, 4 minutes, and then up to 6 minutes in the research studies that they've done. Yeah, that's why I'm asking about this dolphin. And you said it's hard to get in the States.
It's not quite covered as easily. So you have to submit reimbursement through your own insurance company rather than being able to get it directly from your provider and having the insurance cover it that way. But you can get it. Margaret Wallace Duffy was the gal that I connected with up in Canada. And so she has a website, Wallace for Wellness, Wallis for Wellness, for the number. And that's how she connects with people that way and is able to get that device for people outside of her own practice if they're interested. But there are several places across the United States that do use it in clinical practice as well. One of them being Florida, because that's where there's a practitioner down there that's trained in concussion treatment with the same device. They have a concussion protocol as well, doing who knows what. I haven't gotten to that far with that device yet. But yeah, it's really cool, all the different things that they can do to try to treat the nervous system from multiple modalities.
Okay. Wow. Yeah, it's so interesting. And I think it seems to me that it's an exploding area. Yeah, I feel like all of a sudden it's exploding, and maybe I'm paying more attention too. Like I say, it's not new, but I feel like, especially in the gut health world, it's gaining momentum. So, can you talk a little bit about those autonomic pressure points? Because that sounds like something people can just do at home.
Yeah. So it doesn't work the same with like acupressure. So it's not necessarily a site that you can push on. There are acupressure points. I'm not very well versed in them, but I know there are acupressure points across your body that you can use to calm down. I think one of them is like in the fat pad of your thumb and forefinger, but I'm not that well versed in those. But this device, when used on those points, I think they call it the golden triangle. So if you look at your wrist where the little creases are, two of the sites are right on that crease in your wrist, and the other one's about an inch down into your wrist itself. And you hit all those three spots with that little stimulator device. And those three spots go directly to your nervous system. So it's more of a peripheral at reach than the vagus nerve is, but it can also help to calm those down. Same thing with the breastbone location. It's right at the bottom of your breastbone. Doing the acupressure on it, it's going to be more discomfort than anything because you're just pushing on a place that's very tightly knit anyway. But when you hit it with that little stimulator device, it helps to calm things down. Also, it gets the nerves right to your autonomic nervous system. It's very close to your heart that way, so you can actually feel your heartbeat coming down a little bit while you're doing that one. It is advised that you just do some nice deep breathing while you're doing these exercises so you don't forget and hold your breath. So there's probably a combination with some breathing as well while you're calming down the nervous system with the nervous access to the devices as well.
Yeah, I was just thinking, I wanted to ask you about deep breathing because that's free. It's something anyone can learn to do. And it's such a powerful way to help retrain those parasympathetic pathways.
Yeah. So that's one thing that I talk with my patients, and sometimes they poo poo it a little bit until they describe how it's actually beneficial. Because when you just have somebody tell you, oh, you should do some deep breathing, you're like, yeah, whatever, that's not going to do anything. But when you can describe the why of how it works on your nervous system and how it actually affects that vagus nerve while you're doing those breathing patterns, even as simple as something like box breathing can help to calm it down because you're focused on your breathing. So box breathing is you're doing 4 breaths in, you hold for 4, you have 4 breaths out, and you hold that out for 4 as well. Think of it like that little box, but there are multiple other patterns as well. And that's something you can quickly Google and find some really good explanations. And yeah, like you mentioned, it's free. Anybody can do it. It's just understanding the importance. And it's not just breathing, it's actually calming down your nervous system so that your gut can move appropriately, so that you can think appropriately, so that you can get to sleep at night. Because so many people get so riled up before bed that they're up with digestive issues overnight. They are running to the bathroom in the middle of the night because they're so anxious before they go to bed.
Laying in bed, thinking all the thoughts, and yeah. Yeah, I have the same experience with my clients is that I'll mention it in the first visit. They'll eat the diet, they'll take the supplements, they'll prove the deep breathing, and then I have to keep bringing it up and keep explaining it. And then once you do it and really do it a few times, then they start to experience that, first of all, how quickly you feel a difference. And as far as falling asleep, it's amazing how quickly it works. And maybe the easiest way to understand it, because I used to be a runner and I didn't know anything about any of this, but the quickest way to slow down your heart rate is breathing slowly. And it's so effective. So I think it's the same concept, right?
Yeah. Yeah. When you're focusing on your breathing, you can't be anxious. I heard somebody say this recently. You can't be in fight or flight mode and be cautious about breathing slowly at the same time.
Yeah. So how do you get out of fight or flight mode?
There are so many ways. People don't think about it, but one is that deep breathing. You have to focus on your breathing and do it multiple times a day. Cold water plunges. This is not something that I thought of for the longest time until my neurological chiropractor, functional neurologist that I've been working with lately, has me doing cold plunges just with my face, but I call it a diving reflex. But putting your face under cold water for 20 to 30 seconds if you can, and holding your breath while you're under there. And that resets your autonomic nervous system as well, helps you get out of fight or flight. That has been a huge component to help me get that last little bit of my autonomic dysfunction under wraps. And then there are things like neurofeedback. So that's another tool that I used along my recovery process. And neurofeedback utilizes QEEG, so quantitative EEG. We always think about EEGs in terms of looking for seizures, but this kind of EEG is looking for your brain waves, your brainwave activity. What are your four main brain waves doing? You have alpha, beta, theta, and delta, and each of those has a different role, whether we're awake or whether we're asleep, whether we're thinking, trying to concentrate, and it gives you a really good tell of how those different brain waves are doing in your brain when you have your eyes open, when you have your eyes closed, and then looking over a period of time, how is your brain functioning? In neurofeedback is like a biofeedback mechanism. So for anybody that's familiar with biofeedback, it's you're using some sort of a tool, oftentimes with meditation and breathing, to relax or to retrain something. I went through biofeedback for neck pain years ago, and they hooked me up with some leads and some pads on my shoulders to identify the tension that was in my muscles. And as we went through a relaxation activity, I could watch the stress and the tension going away from my muscles. So that's that biofeedback loop. Your brain is getting the feedback that this is what relaxed feels like. With neurofeedback, you can't retrain your brain waves on your own. You can't go and read something and have it teach your beta waves to be more active so that you can concentrate better. You have to actually work at it on that electrical level. So you hook up to, again, a couple little leads like a little EEG, and you do some sort of training program. A lot of it is visual. So you're watching something on the screen and your brain gets the feedback loop, because if your waves aren't doing what they're supposed to do according to the system that it's reading, the screen goes dark, the sound goes away. So you can't see it. So your brain gets the positive feedback when it's doing what it's supposed to do, and you can see it and you can hear what's on the screen. So you do several of these sessions. It usually takes approximately 30, sometimes less, sometimes more, to retrain those brain waves, but 30 minutes at a time for 30 sessions. And all of a sudden your brain is doing a whole lot better. I just went through another round of that from January to March, and I had 50% improvement in my brain waves. And that helps to work on your vagus nerve too, on your autonomic nervous system, because you no longer have this brain that's completely out of whack, that your brain can function appropriately so it can send signals to all your nerves appropriately.
Wow, that's amazing. And when it comes to doing this training, going back to when we were talking about the breathing, I'll have clients say, "Oh, I didn't have to do the breathing too much the last couple of weeks. I wasn't really very anxious." And you have to retrain that nervous system, right? You have to retrain that parasympathetic, because we've lived our lives up until this point, and our modern lifestyle just lends itself to being in that sympathetic fight or flight mode. We may not look at it that way because we're used to it. But don't you have to do, even if you don't feel stressed in the moment, your body's trained to be in that mode, and we have to retrain those new pathways?
Yeah, you have to break a habit, and it takes, what they say, like 21 days at least to build a habit. You can build bad habits just as quickly, but it takes a long time to get out of that habit. So with things like the neurofeedback, you wouldn't necessarily have to keep doing that forever. Breathing, you should keep up those exercises. I explain that similar to blood pressure. If we give you a medication for your blood pressure and your blood pressure comes down, you don't stop taking the medicine just because your blood pressure came down. It came down because we gave you the medicine. And so with your breathing, so yeah, you may not have felt like you needed it these last few weeks, but you aren't training yourself to get in that good habit where you can get yourself. I had a guest on my show and we talked about prosilience, so that proactive resilience. You need to be able to get yourself in a place where if something comes up, you're going to be ready for it because you've already trained for it.
Yeah, that makes so much sense. Yeah. So your body's not just going to go back and do what it used to do, which was go into the stress mode. It's going to be a lot easier to control. Awesome. Having been in the shoes now of your patients, what was the biggest thing that you learned in shifting from a clinician's to a patient perspective?
I realized a lot was you do have to trust your patient to a bigger degree than we do. A lot of times, yeah, there are times when people will come in and they're very anxious and they don't understand what's going on and they're very adamant they want things done and they want things done now. And a lot of people want the easy way out, but there's a lot of people that want to get better and they want to find the root cause of things. And so much of medicine is putting band-aids on something. We give medications out to treat symptoms. We do different treatments just to treat symptoms, and we're not actually treating the underlying cause of it. I've always, even before my accident, I was always a person to find out why are you having this so that we can get rid of that problem and you don't need those band-aids moving forward. But it was realizing that there was so much more that I didn't understand about it. So I didn't realize how many symptoms people could have. I didn't realize what kind of symptoms people can have. There are hearing issues that can come up after a concussion. There are dietary things that can come up that I didn't realize before. There's a lot of problems with hormonal shifts. So it can actually kick somebody into early menopause if they have a concussion because of those hormonal shifts. And none of those things did I realize prior to having my own experience because it wasn't taught in my schooling. It wasn't in any of the CE courses that I did along the way to keep up my licenses. So it's taught me to be more curious and look for things outside of the traditional treatments for any kind of ailment that I'm looking at, whether it's my concussion patients that I see in clinic or if it's one of my friends that has a problem coming to me and they just want some advice on where they should go. I'm not going to tell you to just do X, Y, and Z anymore because the toolbox is bigger. There's so much more to choose from. So I think that's my biggest lesson is learning that there's just so much more that I don't even know.
Yeah, and I definitely agree that providers should listen to patients because what we learned in the books is only a part of it. And I've learned so much from my patients' experiences. And it's important because like they're the ones coming to you. We might think, and especially from a dietitian's perspective, I might have my idea of what we need to fix here, but the patient's going to be the most motivated to work on what they're struggling with the most. So yeah, listening is just so important. And we've all had clients come to us frustrated because nobody's listened to them yet. And that's really sad, actually. This is true in general with healing, but especially with brain issues, it's so incredibly slow. So, what mindset shift did you have to make going through this experience? And what would you say to people, whether it's a brain issue or a gut health issue, who are having to deal with that slow progress? And what advice would you give?
I was very type A before my accident. I liked things the way that they were. And I can't say that I had full on OCD, but I definitely had OCD tendencies. And I was always wanted to do all the things and wanted to do them myself so that I knew that they were done well. But I realized in this whole recovery process that things don't go as planned. Things don't go as you want them to. And no matter how many times you think you've gone over something, there will always be something else that pops up that you didn't expect there to be. And you can't control every aspect of everything around you. You can't control other people around you. You can control yourself and how you respond to things. And I have found that I take a much more relaxed approach to things. And if things come up that are unexpected, yeah, maybe it shakes me for a second or two, but I finally have come to the realization that I can't control everything around me. What I can control is how I respond to it and how I react. And if I'm always getting upset by things around me, I'm always going to be in fight or flight mode and I'm always going to have digestive issues and I'm always going to feel anxious. But if I just say, you know what, okay, we're going to roll with this and see where it goes, I'm not as anxious. I'm not as upset. And my heart doesn't feel like it's going to pound out of my chest at every moment. And I have learned to relax a whole lot more. I never used to relax. So relaxation is really important. That's the one part that I would never practice what I preached very well. I would tell my patients they needed to relax, but myself, I never stopped moving. So now I stop and I breathe and I listen to things and I'm so much more in tune with my body now because I can tell when something doesn't feel right. I can tell when I've eaten something that I probably shouldn't have eaten. I can tell when I haven't had good sleep because I feel it. I know my body so much better because I'm actually taking the time to listen to it.
Yeah, that's huge. Also, just looking at the progress, keeping track somehow, even if you're just looking at your old texts, your old emails, but I encourage my clients to keep track of their symptoms too, because things do get better slowly. And it's hard to remember a few weeks ago, a few months ago, how you felt. And we have a tendency, just as our brains are problem solving. So we look at the problem. So we'll see what we still are falling short of as far as the progress we want to make, and we won't always see the progress we're making. And I think that's just really important to keep in mind when you're making slow, gradual progress. It happens with me all the time with clients. They'll say, I've been having this reflux. And I'll say, first, tell me about the stomach pain, like this stomach pain that's been this mountain for us to figure out for the last 2 months. Oh, yeah, no, I haven't been having that, but I'm having like this tickle in my throat. And I'm like, hey, we solved the stomach pain. Like I want to throw confetti and they like the person, like I had to bring it up. So this is like really common. I'm sure you can relate. But the client doesn't get to experience that win if they don't actually keep track. So I think that's very important to look at what you're coming along with, what's going well, so you can enjoy that progress and feel encouraged to keep going and feel good about all of the things you are doing to work on your health.
Yeah, I think that journaling piece is often missed. We just don't think about writing down things as we go along, but I've journaled off and on throughout my life, and it's interesting to find those journals to figure out how I felt during that time. And sometimes it's eye-opening, so you realize that things have been going on longer with your health than you realize. And you might think, oh, it's just been a couple of months. When you look back a couple of years ago in your journal, you were talking about how you felt X, Y, and Z. And oh, I didn't realize I felt crappy for so long.
Yeah, time flies. We almost always estimate the time wrong, don't we?
And the same thing happens on the other side when you're feeling good. You don't realize how long it's been since you've felt crummy again until you start thinking about it. We're like, oh, the last time I felt like that was this, but oh my gosh, that was 3 months ago already. How did that time fly?
Yeah, yeah, exactly. It's just been so great chatting with you. This is such an important thing with gut health. And of course, your expertise is in brain health, brain injuries, brain issues, but the gut and the brain are so closely connected. And I tell my clients, if we just look at our work together, we have the peg. If we look at it as a stool, we talk about diet, we talk about maybe supplement protocols, and then like lifestyle changes, which a big part of that is the gut brain stuff. So those are the different things we touch on, and they're all just as important in the work that I do with my clients. So this is really a valuable conversation for my audience. Can you tell us a little bit about your work or anything you're working on, how people might be able to find you and learn more about what you do?
Yeah. So I have a website, brainwellnesssolutions.com, and that's where you can find all the things that I do on my own. I have a podcast called Brain Wellness, the podcast. You were on my podcast. Thank you. There was a great conversation about the gut brain connection there as well. But I've talked about lots of different things related to brain health there. I've written a couple of books, one about migraines and then one about my recovery from my TBI, about the first year of my recovery. So shared a lot of vulnerable information on that book, just trying to help people understand what happens in the brain of somebody with a TBI. Both of those books you can find on that website link as well. And then I have gotten back into practice. So Minneapolis Clinic of Neurology in Twin Cities here in Minnesota is where I'm actively practicing and working on creation of a concussion program so that I can help people recover like I did and give them the outside the box, bigger toolbox thinking of the red light therapy, the neurofeedback, the microcurrent treatments, all these other things that come into play outside of the typical TB or PTOT speech type of thoughts.
Wow, that's a lot. So you wrote a book already since you had your TBI. Wow, that's amazing.
And I'm on all the socials. So I post a couple times a week. I do like a mindset post once a week and then share my podcast everywhere too. Yeah, I'm busy.
Yeah, you're still very busy, which is extremely impressive. But it helps you recover, right? To keep your mind doing things. So,
Yeah, it gave me something to look forward to, something to focus on so that I wasn't thinking about how frustrated I was with how slow things were going with myself.
yeah, exactly. Get that time moving again. All right, Mandi, it's been a great chat today and hope to see you soon.
Sounds good. Thanks, Melissa.